Chapter 11, Synovial Fluid Analysis.
Synovial membrane. The synovium is a special membrane that lines some bony joints. It's made up of a layer of single synovial cells that produce an ultrafiltrate of plasma. The point is they serve as a lubricant and transport membrane for nutrients. They contain hyaluronic acid, which makes the fluid very viscous. Now here we have certain kinds of joint diseases that occur with the joint spaces and are classified into 4 categories.
Synovial fluid is formed by the ultrafiltration of plasma across the synovial membrane. These secretions are formed from the lining cells called synovial sites, and what results is a very thick and viscous fluid to serve as a lubricant for all joints, in addition to a nutrient source for metabolically active cartilage. The composition is really made up of glucose and uric acid that's similar to blood plasma levels, but its total protein and immunoglobulin concentrations are only 1/4 to 1/2 of that of plasma.
Fluid group classification. So normally in synovial fluid, the normal color is pale yellow, clear, and viscous. As you're seeing the groups, one being non-inflammatory due to some kind of traumatic arthritis or osteoarthritis or some kind of joint disorder. Group 2, we begin to get into the inflammatory kinds of condition, rheumatoid arthritis, lupus, and other kinds of immune disorders. Group 3 is a septic type of infection, and these will be hazy or cloudy and most likely caused by bacteria, fungi, or mycobacteria. Group 4 are crystal-induced, where we see multiple crystals coming out in the specimen as well due to gout or pseudogout. And Group 5 is a hemorrhagic type of diagnosis where you have some kind of traumatic injury or some kind of bleeding disorder. And here, you're going to see the specimen being completely bloody.
Now these categories can overlap or occur at the same time. Now depending on how bad the joint disease is, the worse it gets, the more these classifications can blur. So here in table 11.2, you have your classifications based on the groups 1 through 4 or 5 hemorrhagic groups, where this is your normal reference range for the synovium in terms of volume, color, viscosity, meaning how thick that specimen is, and as well as cell counts, glucose, and of course the culture should be negative. So please review the differences in these inflammatory versus non-inflammatory septic to hemorrhagic types of groups as to what modes and conditions they would see. Now, synovial fluid is removed by a process called arthrocentesis. It really is an aspiration of fluid through the skin using aseptic technique. Disposable needles and syringes are most often used to prevent any kind of contamination with cleaning or re-sterilization of other supplies. Now, patients should be fasting for a minimum of 4 hours to allow the chemical constituents between the plasma and synovium to balance. A blood sample can also be collected just to ensure the differences in fluid between glucose of your serum and of your synovial fluid. The volume varies between joints, and the smallest amount is 0.1 and usually to 3.5 milliliters. Usually the entire needle is given to the lab for analysis. Now, according to accreditation guidelines, there is a certain collection process for the tubes and how they're handled. So for the first fluid portion obtained, or tube 1, it will be placed into a no anticoagulant tube, and that will be sent for chemistry or immunological evaluation. The next portion, or tube 2, will be collected in an anticoagulant for microscopic studies. And the last portion, or tube 3, will be placed in a sterile anticoagulant tube for microbiology studies. Now, for these specimens, they should all be transported and analyzed at room temperature as soon as possible as they get to the lab, because things start to break down or change after time. So first, cells in the fluid can alter chemical composition. The detection of microbes can be jeopardized if it's not tested right away. And cellular elements such as white cells and red cells can start to break down. And again, we don't want to refrigerate this because refrigeration can adversely affect any microorganisms present. So on these types of specimens, we want to perform a physical and a microscopic examination of the fluid. So let's talk about the physical exam, which includes the assessment of color and clarity in addition to viscosity for synovial fluids. So normally, the synovial fluid will appear pale yellow or colorless and clear. Any variations such as red or brown can be associated with trauma during the process or with any disorders that disrupt that synovial membrane. Now, as for clarity, there are a number of substances that could modify the clarity of them. First, it would be the cellular elements such as red cells, white cells, synovials, fat droplets, and rice bodies, which are just flotation little pieces that look like rice, and they can be causing some kind of turbidity in the identification of the microscopic exam. Now, what's different from this to other ultrafiltrates of plasma is synovial fluid has a very high viscosity concentration compared to water because of the mucoprotein hyaluronate. So this is a high molecular weight polymer that serves as a lubricant, and during inflammatory processes or conditions, it can depolymerize, and it would make it similar to the presentation of water. There can be a test to discuss the viscosity at the bedside as it is expelled from the syringe. So a normal drop forms a string of at least 4 centimeters long before breaking. The viscosity of this fluid would be considered abnormally low when the string breaks any earlier, forming water-like droplets. Now, if there's any clot formation, this usually tells us or indicates an abnormal amount of fibrinogen. This is a high molecular weight protein and normally cannot pass through a healthy synovial membrane. So with abnormal processes, the damage to the membrane or a traumatic procedure with contamination of blood can cause this fibrinogen to be present, which will result in a clot. So therefore, a portion of this fluid should always be collected in an anticoagulant tube, such as EDTA or sodium heparin, to prevent any of these clots that will interfere with the process. Now, when we talk about microscopic examination, we're using a hemocytometer to count the formed elements such as red cells and white cells. If it's very thick or very viscous, the lab may use an enzyme, hyaluronidase, to be used as a buffer to reduce that viscosity so we can have more efficient counting of those cells. So normally the red blood cells in synovial fluid is fewer than 2,000 per microliter. It's increased, it could be due to a hemorrhagic process or some kind of infection. White blood cells are normally present in the synovial fluid at counts lower than 200 white cells per microliter. White blood cells greater than 2,000 are typically associated with some kind of bacterial arthritis, but it can also occur in certain types of gouty arthritis as well. Now we must talk about crystal identification, which is very important in synovial fluid. The identification of certain types of crystals definitely distinguish a specific joint disease. When crystals are present, they are typically of only one type. Sometimes you have cases of both monosodium urate and calcium pyrophosphate. They have been found together, but clinically significant crystals will not have any type of irregular or jagged edges. That will be artifact. So let's talk about the most important types of crystals here. So monosodium urate crystals indicate a type of gouty arthritis. They are present intracellularly in white blood cells during the first or acute types of disease stages, and they look like needles with pointed ends that extend the cytoplasm of the white cell. So free-floating crystals can also be present, and under polarizing microscopy, there is a very strong bifringence. So you will see that there's going to be a bright against a black background with a compensator. These will negatively show and appear yellow when their longitudinal axis are parallel, and they will also appear in blue when their longitudinal axis are perpendicular to it. Observing calcium pyrophosphate crystals are seen in a sort of diseases that refer to usually a pseudogout, and they really are associated with the calcification of cartilages, which include a degenerative type of arthritis, as well as a type of metabolic diseases such as hypothyroidism or diabetes. Now again, with these by polarizing microscopes, you can see the crystals, and they will be opposite than in the monosodium urate. The crystals in this case will be blue when their longitudinal axes are parallel to the red compensator plate, and yellow when their longitudinal axis is perpendicular. They also appear shorter and not as long as those needles in the monosodium urate. And we'll just So we're going to take a look at this image here. We have a polarizing microscope with a red compensator plate with the axis in this top image going this way. So now we're going to look at the crystals that are present. First of all, these are long, needle-like, and when they are parallel to the axis and they're yellow, and the perpendicular crystals are blue, we can assume that these crystals are monosodium urate crystals. Now, similarly, if the axis is pointing the other way, you're still seeing the parallelity of the yellow crystals and the perpendicular of the blue, which is still the monosodium type of urate crystals. This would be opposite if you had calcium pyrophosphate dihydrate crystals. Those will be yellow perpendicular and blue parallel to the axis with shorter, plumper rods. not as long and needle-like as the monosodium urate. There are also other types of crystals seen, such as the image on the top right. We have a cholesterol crystal. It's best seen on wet preparations or unstained slides. And you see they have flat plates that are rectangular and they have notched corners. Seeing cholesterol crystals indicates a certain type of chronic inflammation. Another type of crystal, hydroxyapatite, which are usually seen intracellularly of a white blood cell, and they're not usually seen visually, but have to be viewed upon electron microscopy. They are tiny, needle-like, but they're not bifringent, and they can induce an inflammatory reaction. Corticosteroids is another type of crystal you might see, but again, with a full patient history, you can identify those as induced due to steroid injections, and they're really of no clinical significance because they're really trying to alleviate the problems going on with certain types of arthritic conditions. Now, chemical analysis has been done as well on synovial fluids, but few analytes really provide any diagnostic information. Now, certain things such as uric acid are really similar like plasma, but you can see increased level due to the monosodium urate crystals, which are indicative of gout. As for glucose, the evaluation for glucose levels has to be drawn at the same time they're doing a blood plasma level. So really, if a patient is healthy and fasting, the glucose should be equivalent. And when it is decreased, it normally determines that some kind of condition is going on. So normally total protein is about 1/3 of that of blood, and an increased amount can happen due to the changes in permeability, especially during inflammation of joint diseases. Now, lactate can be increased due to anaerobic glycolysis with severe types of inflammatory conditions because there's increased demand for energy, which tissue hypoxia can occur. All synovial fluids should be cultured to determine if there is any kind of infectious agent causing this type of effusion. A lot of the times the agent can be identified using a Gram stain because they're mostly bacterial in nature.